Okay, so I just had the most interesting call with, hello. I just had the most interesting call with the founder of the Leo Project. And I found my practicum. I feel like I've been thinking about what my practicum would be for the year, for the entire summer of what am I gonna focus on? And I knew I wanted my practicum to be in implementation, like global cancer care delivery, health system strengthening, and implementation science. And I read this book, Closing the Cancer Divide, an Equity Imperative, written by my advisor, Professor Rifat Atun. And it takes research from hundreds of authors of how cancer care, the gaps in cancer care in low resource countries. The Leo Project, and a little bit about it, is that it was founded by someone who went through the MPH program at Harvard, and they were actually based in Kenya. She is, her name is Jess, and Jess actually had cancer when she was a young adult. And then she also had a friend who had cystic fibrosis and passed away. And when she recovered from cancer and then supported her friend, she said that she would have a project, or she would work on something dedicated in her name. So that's where Leo Project comes from. And what started off as a knowledge center or a learning center in Kenya, that's what it started as. It became a place where people came to learn, people came to build skills, vocational skills, budgeting, finance, etc. Some tech skills, maybe. It's just a space. But in Kenya, then, she saw that there's no healthcare services in the counties in the area she was located. And so they started building a health facility that provided basic ANCs, basic blood draws, basic things that the community needed. And it became a place where many people started going. And then the thing in the community is, initially, people often don't go to care until they need care. But because of the people relationships that were built up at this site, people started coming in for return care, and it really started improving health in the community. And this facility now has a variety of different things, but they're following a similar model as Partners in Health in some ways, that who I've been in contact with for my practicum or research. And essentially now they're trying to open an oncology branch or in a maternal health branch and provide both services as well as referral. So the practicum that she reached out to me about is going to be focused on, let me just read you the exact thing. So an AI in the implementation science to leverage oncology and maternal health services, and doing a comprehensive gap analysis, the bottlenecks, the errors along the whole continuum of care. And it's not just focused on digital health tools, but really mapping out patient pathways, identifying where the breakdowns are, human error, and really engaging with different stakeholders, looking at the opportunities specifically on the oncology space. And it's not just, and I think that part of this is doing a roadmap and really thinking through. But what's exciting about this, or in the conversation that I had with her, I took some notes and I want to make sure I am able to go through these notes, is that how she set up this health center even is, first, a lot of Kenya is paper-based, and paper-based clinics are everywhere, and there was no cancer treatment anywhere. So nobody had cancer because it's not detected, or there's not a language around cancer there. And she also said that there was no maternal health deaths because it wasn't reported. People are dying in their homes and the government doesn't know. The Ministry of Health doesn't know because there's a challenge of data collection to start with, or even first data collection and then clean data. So it's not even at that clean data stage, it's at that collection stage. So why this is so fascinating, or why this is interesting, is because there's a lot of opportunity here to build something from the ground up, build something great. And she said it's it's a startup-y type of environment, because she used to work in the tech industry actually, then she went to finance, And then she ended up getting sick and then starting to do something different. And she has a bit of a tech background. She believes in the opportunity of technology a lot, but she also is like, care, like I mentioned, care is deeply human. It has to be people-centered. It has to revolve around connections. It has to revolve around really building trust in the community. You have to deeply understand stigma. You have to understand change. You have to change management. You have to be able to work with the community. And she really liked that I come from a community-based participatory background where you're involving the community to really build the tools that you're trying to build or build the systems that you're trying to build. And she basically started this program when she was at the Learning Center. And from the Learning Center, she expanded into this health facility. And now while she's building out the referral line and the maternal health line, she is going to Dana-Farber, Rwanda, the Butaro Center of Cancer Excellence, to learn about how things are there and take it as a model. But as I mentioned, Rwanda is this unique innovation ecosystem. It's not typical, I would say. And it is very, very, it has all the Harvard doctors coming in, it has people studying how to make things even better, and it's a little more structured. So my project there that I have an opportunity to do would be designing a patient navigation program. So how are you referring patients out? But it's a little more bite-sized and specific, and here I'm excited to do something that really is like, make it your own, and it's a lot more scrappy, but you know, it's where you can really get things done. And she was like, I already am gonna select you because I like you as a person, but I also like your heart in this and your skills. I think it's a great match. And she's like, you have to connect with Kilvin, our chief of staff. He is a great tech person. He will tell you about the clinics that have 6 million paper charts, but they also have a team that is, or one person that is really good with data, will do anything with data, will create the systems and understanding of data. And I like that their team is small and tight-knit, and we all work together to really develop our solutions. And right now, with the oncology space, they're going to be focused on breast cancer, cervical care, and prostate cancer. And with a focus on, they have already been focused on education, the mental health, and the screening, but they really want to develop that referral-related pathways. And that's kind of the next step there, but also really mapping out, I'm going to be mapping out all of these different workflows and pathways, and then also looking at how technology can be integrated in. But she's like, there's truly no data. You don't have data on who died, like no one died of COVID in Kenya. And the thing with the government as well is it's a bit corrupt. They don't necessarily pay their community health workers. And, you know, really understanding the political climate is important as well. But she's really emphasizing the importance of data so that the ministry can work with it, so that they can really build on it. And yeah, I think that she's going to be pursuing her PhD at Harvard, or applying at least, in global health while working on this project. And she talked about the ethical concerns of, the ethical concerns of referring someone with like esophageal cancer when you don't have treatment there. And so they really have to be picky and choosy about what they're picky and choosy. That's really how that is set. There's a lot of ethics involved, and I'm excited to apply my ethical course on this, but it's very, very stigmatized. Men don't ever come in for care. No one, you know, it's a very, very interesting topic. And then in terms of outpatient, they started as a resource center. David Walsh is the person she recommended to reach out to. He is from BHI. I think it's from the Brigham, but she pitched her idea to him, and he's the one who's like, okay, I believe in your vision. And then they talked to PIH and they talked to others, and then they're like, we believe in you. We're going to take a chance on you. Let's build out this health facility and build out this outpatient clinic. And then she did the Global Health Delivery Intensive, and she built it out during that process. And honestly, I think we really connected in a certain level of like, when she was sharing her story initially, people really connected with it and wanted to talk to her about it. But then she wanted to distance herself from the story because she really wants it to be about the cause and the work that they're doing, but that's what people connect to. And so now she's back to involving it in her story, But I really resonated with that because I'm someone who has also had to, you know, when I biked across the US, I told her how I visited 200 different communities, how I would get up every day, I would share my story and who I am to reduce stigma and to increase awareness in the community of like, hey, this is something we can talk about, this is something okay. And she said stigma is the biggest challenge there, and it's something that they're trying to address. And I think that like talking about each other's stories and vocalizing it and how you feel about that is something we connected about too. And then she was emphasized that nonprofits have an interesting way of like, she didn't want to create any parallels to anything or things that already exist, but there wasn't something that exists like this, and she's learning from similar models as well. And she leveraged Amazon. She applied for an AWS thing, and they built out an EMR system and the tools there, which is very interesting. And she wants to not just build technology, but get to the bottom of the conditions. They have people coming in from Brigham as well as other locations where she's developed really close relationships, and they bring in a team to really build out the entire service model for like the mental health space or for the certain lines. And so there's a lot of people involved in this process. And I love that she's the founder and she's going to be working with me. And she talked about Kenya has 47 counties and they kind of all operate separately and don't really interact as much. But, you know, when she talked about the Rwanda system versus the Kenya system, like Rwanda has perfected their system over 10 years and it's a perfect model, but there's things we can learn. But we all have our own political climates. And she works with a network of doctors at the Brigham Hospital, and she wants to develop an oncology space. She has a global health advisory board. She's supervised. But what's important to her is that US doctors are not just coming in to do care. You know, she's like, there's a lot of Kenyan doctors who are smart, and, you know, a lot of Kenya is filled with US doctors. And what she wants to do is really make sure that people who come in are both understanding of the global experience. And she liked that I've done global experience with the Ministry of Health, with the various different Gates Foundation, and understand on the ground the diary studies that I did and the experiences. And I think I would get the opportunity to do ethnography, which is really, really exciting. And I'm like so excited. Anyways, I am like losing my marbles because I'm so stoked about this project. And then, what else is there? Anything to say? It seems like she wants me to map out both the maternal health and the oncology service lines, which is exciting because you know my experience in maternal health. I was so passionate about it. The maternal mortality crisis in the US is something I focused on at Google Health. I was focused on low-income women, but also just improving pregnancy. And so she's excited about, you know, my understanding. And something we talked about is oncology and like prenatal visits, and how, for example, they've been able to get women to come for 8 prenatal visits, which is more than the US. And it's because of the people and the human aspect. But I told her about the graph that is like, if you reach the woman who did not go past 4 visits, like the maternal mortality rate is like drastic. Or there's some diagram that I saw when I visited a visited a summit in Arkansas, which is the heart of the maternal mortality crisis. But yeah, oh my God, I am so freaking excited. But she said the county itself, Laikipia County or something, it has an outpatient, it has vaccines, it has EKG, but it's very rural. But yeah, people pay in shillings and it's very affordable. But chemotherapy, people have to pay out of pocket. And people will pay their entire savings to save someone for just 1 month. But then it's an ethical decision. Like, do we tell you, hey, you know, continue on for 1 month, but you're going to use all your savings and you're not going to be great? Or like, how do you talk about like, hey, it's better to not do that, and what should they do? But, you know, if someone has to pay 20 shillings, they're like, I don't know if I want to do this. But in Kenya, you know, it's like very antibiotic. Like everybody has antibiotics, or like they just take a bunch of pills, and they used to just take a lot of pills, but not really get to the root causes of health. But yeah, I'm really excited that they have a Dana-Farber connection, strong connection, and like it gives me the best of both worlds. And she's willing to start next week, and I would be working with like Kelvin, the chief of staff, as well as one other person. But yeah, oh my fucking god, I am stoked. I think the last thing I'll say is that she specifically is the person that really sold me on working with this rather than a larger nonprofit that I want to work at in the future, Partners in Health. Because one, her story, I literally started like crying and felt shivers in my body when I was talking to her, both from her story, but it was really about the work that she's turned, what she's done, the way she's like amplified the voices of others, but is so working with the community, and the fact that she will be my mentor, and she will, she was so excited in the conversation. We talked for 2 hours, like 1.5, 2 hours. So yeah, I just thought I would share this, and I know that I am very energetic on this call, but it's because I'm just like, I feel like I've had 5 coffees from this conversation.